Newer techniques in surgery, yes, we have a lot development in the field of nuclear medicine. We do radio-immunoguided surgeries. We do sentinel node biopsies. Even in the field of surgery, to preserve the breast, we can even preserve the nipple areolar complex today. We do nipple areolar sparing mastectomies, skin sparing mastectomies. Then for reconstructions, we have various techniques. Earlier we used to use implants. Now we know that implants cause problems during radiation therapy. So we use autologous tissue. Autologous tissue, earlier we used to use muscles like the latissimus dorsi or the transverse rectus abdominis muscle. But today we don't use any muscle. We take your own fat from your tummy with blood vessels and replace the breast with this autologous tissue. So you have two advantages. One is a tummy tuck-in, and at the same time the breast completely reconstructed. We have scarless surgeries of the breast, which we do mainly for benign conditions. So for benign tumors, which are up to 3 centimeters, we take it out with a 2 millimeter or a 3 millimeter incision done at our center. It has not yet been recommended for malignant lesions, except for the diagnosis.
So there is also a new thing called digital breast tomosynthesis.
Digital.
Could you please
It is,
yeah, how it is different from mammography?
Yeah. This is called digital breast tomosynthesis. Now, this is a newer technique in mammography. If you see mammography, the evolution of mammography, originally it was called the analog mammogram, which was like your old cameras. Then came the digital mammograms, which came in like your digital cameras. The advantages and disadvantages are more or less the same, like your old cameras and the newer cameras. Older cameras, you have to have a film. You cannot enlarge, you cannot reduce, you cannot see it accurately. You cannot transport it to some other system, you cannot store it. So, but the digital cameras have all these modifications. 95% of hospitals, modern hospitals today, have a digital mammogram, but very few among them have tomosynthesis. Ours was the first center in the state having tomosynthesis. Now, tomosynthesis is nothing but a specialized mammogram where normally instead of taking 2 or 3 films, here we take about 15 films in a period of about a minute or 2. The most important advantage of tomosynthesis is causes 50% less pain for the lady undergoing a mammogram and 30% more accurate. The biggest advantage of tomosynthesis is when you have dense breasts. And in India, majority of our young ladies have dense breasts. So tomosynthesis is a very important, accurate method of diagnosing a very early cancer among Indian women.